Sepsis is essentially the body overreacting to an infection that has been acquired. It causes it to attack its own tissues, which can lead to multi-organ failure or death.
It's either normally bacterial or viral in nature. It normally travels in your blood, or it can be urinary based.
Because it's an infection in the bloodstream, it can travel to anywhere in the body and it can cause very serious injury internally.
Claims for sepsis tend to focus on the management of most likely wound infections, which can then progress to more significant and serious injury.
Sepsis is a condition that affects over 250,000 people a year, and there are up to 44,000 deaths a year as well.
More often than not, it's recognised following operations, and where there has been an open wound in the body, infection can set in and then sepsis can develop.
Sepsis can arise from the tiniest of infections. It can be from something very small such as a graze. It tends to occur in young children, older adults or people with compromised immune systems, but anyone can be subject to it.
There is a standard checklist that both emergency care workers and hospital-based care workers use to recognise signs of sepsis, and so when your observations are taken, so that's your pulse rate and your temperature and blood pressure, if they hit certain levels, that should alert your clinicians to the fact that you are potentially having a septic episode, and that should set off a chain of appropriate treatment.
Making a claim for medical negligence is relatively straightforward with the help of a good, experienced solicitor.
Sepsis, as well as potentially leading to death, can lead to life-changing injuries for a patient, so compensation may enable them to get their life back on track.
In order to be able to pursue a medical negligence claim, we first of all, for our clients, pursue an investigation into the standard of treatment that they've received, and we will get independent medical evidence to judge the standard of care that they've had. Once we've then received that medical evidence, we can then advise our clients on how likely they are to be successful.
When we help achieve a successful outcome for a client, it can really improve their lives and hopefully put them back in a position they would have been had this not happened to them.